So our presentation today is part of a series that we're doing. We're doing two different presentations. Today's focus is on mental health and human services, stacking credentials. And the team who brought this together today is Katie Ebert, Haley Brown, and myself, Dr. Wendy St. Pierre. So Katie Ebert is the Student Services Coordinator at our Rockland Center. Haley Brown is a Student Services Coordinator out of the Augusta campus. And then myself, I am an Assistant Professor of Mental Health and Human Services, as well as the Academic Coordinator of the Mental Health and Human Services program. So this document, this presentation includes information about some of the educational pathways at UMA. It is certainly not all encompassing. I did my best to capture a number of different pathways, but there certainly could be questions about different ones as well. But I'm covering the ones that students most often ask about. So we're going to be talking about certifications and licenses, which are available to mental health and substance use treatment professionals here in Maine. The presentation that I'm using today was actually originally created through a collaboration between myself and a colleague of mine named Terry Ryder. So I'm just giving her a shout out for her help in pulling some of this information together that I brought to all of you today. So topics for today. We're going to talk about the differences between a certificate versus a license and an educational certificate versus a professional certificate. We're going to be looking at descriptions we're going to talk a lot about different acronyms today, and each of these acronyms I'm going to be describing. So we're going to talk about the MHRTC, the SART, which we call as the SART. We're going to talk about behavioral health professional, BHP, as well as conditional licensed social worker, and that acronym is LSX. The field of human services uses lots of acronyms, so we're going to dive into some of those today. We're also going to be talking about the mental health and human services associate's degree pathway and which credentials that makes you eligible for, as well as the bachelor's degree pathway and the credentials there. All right. Sorry, I'm having issues with my mouse. Where's my... Okay. There we go. All right, here we go. Okay. So the first slide here is looking at educational certificates versus state certification and licensure. So certificates, licenses, and certifications all equipped people to work in their fields of study. Educational certificates are awarded by colleges and universities for completing required coursework. So what I'm trying to do is make the distinction between a professional state level certificate or license and an educational certificate that you get from a college or university. Just because you have an educational certificate, it is not automatic that you then get the state level certificate. There is an application process, and there are generally additional steps that someone needs to take to be able to do that. So state level certificates, certifications, and licenses are created by each state to have individuals show that they can meet state and national professional and educational standards. Some often include requirements to successfully pass a national exam. And yes, an exam means a test. Many of these licenses and certificates we're going to be talking about do have a required test for each individual to display competency. their ability to understand and use the information appropriately before they're allowed to serve consumers in that field. So what I'm reviewing today is focused on Maine, because our institution is in Maine and the majority of our students are here in Maine. If your goal is to go and work in another state, then it's going to be really important for you to research the state licensing criteria for that state. Maine has different criteria than other states around the country. So if you said, oh, I'm going to get my degree from UMA, and then I'm going to move to Colorado, well, make sure that you research what Colorado requires to become a licensed mental health professional in that state. I think one of the things that I didn't say is, if you have questions as I'm going through these different things, feel free to put them in the chat. And I have Haley helping me manage the chat. Haiti and Katie will be watching it. So that as I'm in that area, if I can help answer a question about it, then we can do that. We'll also have time at the end for questions then too. All right. So Maine MHRTC and MHRT1 certifications. That's what we're going to be talking about here. And you have lots of faculty at UMA saying, oh, if you take this class, it helps get you closer to being eligible for the MERT-C, the MHRTC. And lots of students say, Wendy, I don't understand. I don't understand what the MERT-C is, what you mean by that. So there are two levels in the MERT-C. So there are two levels in the MHRT. So mental health rehabilitation technician. That's what the acronym MHRT stands for. It's quite a it's quite a lot to say often, so it's become abbreviated as the MHRT. So the two levels we're going to talk about is you have the MHRT level 1 called the MERT-1 and the MHRT-C. So the regulations associated with the MERT-1 and the MHRT-C are managed by the Center for Learning, abbreviated CFL, through the Muskie School of Public Service. And the Muskie School is part of the University of Southern Maine, so it is connected to one of our sister campuses within the University of Maine system. And for additional information, you can go to the CFL-muskie.org website and read all about the certifications for the MERT-1 and the MERT-C. So for the MERT-1, this is, you become a certified professional to work with people who have severe and persistent mental health disorders and who live in residential facilities in Maine. This certification allows the organization to bill Maine Care, Maine Medicaid, for the services provided by the MERT-1. This role supports consumers who live in residential settings by supporting them in completing their activities of daily living, providing the residents in that facility with supervision, transportation, and community integration, meaning they bring the residents into the community to receive services, both medical and mental health care, to participate in community activities, and more. In order to become eligible for a MERT-1, you need a high school diploma or equivalent and the following 5 trainings, usually provided to you by the agency you work for. And so the 5 trainings for the MERT-1 include first aid, the Red Cross level first aid, as well as CPR. You need a class called Mental Health Support Specialist, and agencies make this training available as well. You need training on a de-escalation technique. such as these are different types of de-escalation techniques used by mental health agencies across the state of Maine. One of them is called NAPI, another is called MANT. And you need to complete the training to become a certified residential medication aid, a CRMA. Your CRMA class and subsequent training is what prepares you to administer medications to the residents. Excuse me. So these are the 5 trainings connected to the MERT-1. And when students come to UMA and say, I want to get a taste for the field, what can I do now to work in the field of human services, get some experience under my belt, make a little money while I'm going to school? And this MHRT1 is a great pathway for individuals to do that. Because if you look at this training list, it does not require any college level classes be completed. It requires these 5 trainings, which are provided for you by the agency you work for. And then they will pay you to complete these trainings in the course of your work.
Wendy, we have a couple of questions about the MERT-1.
Okay.
So Leanne had asked, or she had made the statement that apparently the CRMA is no longer required for the MERT-1 unless they're working in a residential home. I'm not sure if that's up to, I'm not sure.
Yeah, and I'm not sure either. That was my understanding, is that the MERT-1 required those 5 trainings because the MERT-1 was created for people working in residential homes. If in fact they have expanded different agencies and organizations that can bill under the MERT-1 certification, then they may have modified that. And I will have to go and do some research. I was not aware of that change.
And then there was another question that Rochelle had. Do you need to have the 24-hour or the 40 hours for the CRMA?
That would be agency specific, because the agency wants you to get certified to meet the needs of their organization. So you would want to make sure that you are pursuing trainings based on the place that you're going to work. Being proactive and trying to get those trainings ahead may or may not be helpful to you if the organization you decide to work for has different requirements.
Great. And then the only other question that I had seen that I'm seeing so far is that I have a student who is asking, can someone convicted of a felony be certified in these areas?
So the agency would be doing a background check, because that is required for individuals who are working in the field of human services. So you would expect to have a background check from that agency, and you would have to, some agencies require, if you have something concerning that's going to come up in the background check, that you let them know about that ahead of time. You share with them a statement or something so that they know what happened, what have you done since then, and the more time that has passed since your issue, then the higher the likelihood that that will not be an issue for the employer, but those decisions are made on a case-by-case basis.
There's a lot of chatter in the chat about whether or not they require CRMAs or not. So we'll make it a point to find out the official answer, and we'll get back to all of you. But in the interest of time, we want to keep going with the presentation. So thank you.
Okay. All right. So the next piece is the MHRTC. So the MHRTC options at UMA. So students can complete their MHRTC courses within the UMA Mental Health and Human Services program. You can become enrolled specifically in the MHRTC certificate program, which is requires 10 specific classes. I have the list in one of the next slides. You can become eligible for your MHRTC with the completed Associates of Science degree in Mental Health and Human Services, and you could become eligible for your MHRTC with a Bachelor's of Science in Mental Health and Human Services. If you have already completed some of your MHRTC required courses prior to the fall of 2019, when they made significant changes to the curriculum, you need to contact the Center for Learning to determine what courses you need to take to complete your training. And so those decisions are made again on a one-on-one basis. These are the 10 classes required at UMA for the MHRTC certificate. You have HUS 134, Cultural Competence in the Helping Professions. The 3 at the end of each of these represents this class's 3 credits. You have the second class is HUS 212, Case Management. Third class is HUS 218, Community Mental Health. Fourth class is HUS 230, Interviewing Skills for Human Services. Fifth class is HUS 232, Crisis Intervention. Sixth class is HUS 233, Trauma Recognition and Intervention. Seventh class is HUS 236, Foundations of Vocational Rehabilitation. The 8th class is HUS 309, Counseling and Human Services. The 9th class is HUS 335, Substance Use Disorder Counseling within a Diverse Population. And the 10th class is HUS 350, Mental Health and Aging. To receive the certificate from UMA, you need to complete all 10 of these classes. According to the website at the Center for Learning, they indicate that if you have completed the first 9 of these classes, that you will be eligible for your MHRTC from them. The 10th class, HUS 350, Mental Health and Aging, is considered an optional class under the Center for Learning, but it is not considered an optional class at UMA. For the certificate, you need to complete all 30 of these credits. When a student has completed the 10 required classes, they can apply for their full MHRTC certification. And I have 4 steps listed here. You're going to email the UMA Registrar's Office to notify them of your completion of the certificate requirements. They do not, because so many students are taking these certificate classes along with their associates or their bachelor's degree, they don't always know when someone has finished all 10. So I always say they go, a student says, I finished 10 last semester and nothing happened. You need to notify the registrar when you have completed these 10 classes, and then you will be issued a UMA certificate indicating the certificate's completion. You are then going to print the application from the Center for Learning website to apply for your MHRTC. The third step is you're going to contact the UMA Registrar's Office and request a copy of your official college transcript to be emailed to the Center for Learning. You're going to complete the application you downloaded from the Center for Learning and mail it to them or email it to them as instructed on the form. There is no application fee for the MHRTC certificate in Maine. There is also no standardized test required. So once you become a full MHRTC, the certification lasts for 2 years. When your certificate is issued, you will receive a start date and a renewal date. During the 2-year certification period, you are expected to participate in 18 hours of continuing education called CEs in the topic areas connected to the MHRTC domains. And those learning domains include ethics, mental health, social policy, mind-body connection, trauma, vocational rehabilitation, counseling, and community integration. So any questions for me about the MHRTC before I move on to the next credential we're going to talk about? One of the things with the MHRTC is I focused on when someone has all 10 classes done, you can get your full MHRTC. For someone who has completed some of the classes, somewhere between 4 and 5 of them. So let me go back to the list. So maybe you're in a place where you have the first 4 or 5 of these done, and you're wondering if you can do anything before you have the rest of them done. The answer is yes. You can apply for what's called a provisional MHRTC that is can be made available to you. Once you receive your provisional, you'll have a specific amount of time that the Center for Learning gives you to complete the remaining classes towards the full certification. So that's considered the provisional MHRTC. If you have the provisional certificate, you can work in the field as an MHRTC. You do have to let them know it is a provisional one, but you actually can bill for MHRTC services if you have a provisional certification.
So it looks like Desiree has a question. She
Okay.
says that she has a BHP and works in residential. How would this affect this?
The BHP and the MHRTC are completely separate certifications. The BHP credential is not in this list anywhere. So we're going to talk about BHPs in a minute, but they are separate. They're overseen by different groups, and they allow you to do different kinds of work and bill for different kinds of work. Did that answer? I feel like there were 2 parts to that question. It was BHP, and work in the field. If you're working, if you're working in the field, you actually could contact the Center for Learning, who oversees the MHRTC, and sometimes you can waive one of these 10 courses and replace it with work experience. So if you worked in the field for a year or more, that's something else that you could pursue as well.
And then, and who should Desiree contact? I think we just answered that, the Center for the CFL.
What about the CFL, Haley?
Desiree is asking who does she contact for more information?
Yeah, so it's the CFL-muskie.org. And if you go into any Google search and you type MHRTC, Maine MHRTC certification, Maine is the only state who has this specific certification. So a Google search will bring up one of the first items on your search list will be the Center for Learning Muskie, who oversees it. And then you would go through their website to follow. They have lots of lists of, you want your MHRTC, what do you have? Do you have work experience? Do you have some college classes? And then it walks you through the variety of different combinations.
Awesome. And then Heidi had a question about whether or not the MHRTC is included with the Bachelor's in Mental Health or not. Is this still the case, or?
So a student with the Bachelor's of Mental Health can apply once they graduate with their bachelor's, whether or not they have taken these 10 classes. So some of these are required. So everyone who graduates with the Bachelor's of Mental Health will have done 212 case management, 218 community mental health, 230 interviewing skills, and then 309 counseling. So that's 4 of these classes are required for the bachelor's degree. So a student can apply with their bachelor's degree. They would still have to provide their transcript. The Center for Learning staff will review that and say, okay, you took these 4 of the required 9 classes from their list, and then they can issue you an MHRTC with some criteria saying, okay, over the next 2 years, because you never took vocational rehabilitation, for example, if you've never taken that during your time at UMA, they're going to say in the next 2 years, some of your continuing education needs to be focused on vocational rehabilitation. And they're going to check that at your 2-year renewal period to make sure that you completed learning in the other areas that your bachelor's degree did not include. So if a student's goal is to have their MHRTC at the end, we have plenty of room in the bachelor's pathway to take these other classes as electives. Also, if a student chooses in the bachelor's pathway, the adult mental health concentration, that concentration includes all of these classes. If someone is in the generalist concentration, then that you would have to make a conscious choice about choosing some of these. Did that answer your question, Heidi?
Yes, she said that that was her case exactly, and she was hoping that the slides would be made available.
So Haley, if you have the registration list, and Haley, you have access to this slide deck.
I sure do.
We can download it and share it. And then any participants would have the links that I included as well for the different sections, for example, at the Center for Learning.
Yep, that will make
Wendy, I had a direct message to me asking, do you have to have the MHRTC if you have your associates in mental health?
It depends what kind of work you want to do. Again, your associate's degree is an educational credential. In order to do specific types of work in the field, agencies bill under different state level credentials. And the MHRTC is one of those state level credentials. So you'll only need the MHRTC from the Center for Learning if that's the type of work you want to do. If you don't see yourself ever doing working with adults with severe and persistent mental illness who live in the community, then maybe the MHRTC is not a credential that you need to pursue. But there are lots of jobs that employers like to see that an individual has pursued this credential because it shows that you have this breadth of skills and knowledge for working with adults with severe and persistent mental health disorders. Other questions before I move on to the next credential with more acronyms to come?
I think we're good right now.
Okay. All right. So this next section, we're going to be looking at, again, some additional certifications and licenses. So this first one is the CADC, Certified Alcohol and Drug Counselor. In the state of Maine, that license, that is a professional license, is overseen by the state of Maine Alcohol and Drug Counseling Board. And that is the board who oversees that credential, and it falls under the state of Maine professional licenses. The next one is the LADC, Licensed Alcohol and Drug Counselor. Again, state of Maine Alcohol and Drug Counseling licensure. And then the third one we're going to look at in this next section is the BHP, Behavioral Health Professional. And that training is overseen by an organization called Woodford's. And so the link that I have here on this slide is for the Woodford's Behavioral Health Professional Training. So we'll look at each of these next. So Certified Alcohol and Drug Counselor, CADC. An individual with this professional license provides entry-level individual or group alcohol and drug counseling services, unaided, and you must be at least 18 years or older to even be considered for this license. The individual may not engage in independent or private practice. All work needs to be performed under the supervision of a certified clinical supervisor, a CCS, within an agency. The individual must have completed either an associate's degree in the mental health field or at least 30 credit hours of college level courses in specific subject areas of mental health and social sciences. Within the licensing criteria, they actually list the classes that they will accept. I didn't include that list in here, but I will say that our UMA Substance Abuse Rehabilitation Technician Certificate, which is a 30 credit hour certificate, and the UMA MHRTC certificate meet the criteria for an individual to apply for their CADC. A person may also be able to use some work experience instead of education as part of their application. So you apply for this license once you have completed 30 credit hours or more, or that in combination with some work experience. And then you need to successfully pass the national exam. The exam is created and offered by a group called IC and RC. They create and oversee the exam, and it is called an Advanced Drug Counselor Exam, ADC exam. So you need to complete the application, pay the fee. There's always a fee for when you're pursuing, actually the MHRTC doesn't have a fee, but when you're looking at other licenses, there is a fee for the license as well as a fee to take the exam. The next level, so once an individual receives their CADC, they're going to work under someone else for a period of time. They're going to receive supervision from that certified clinical supervisor. They're going to be working with consumers in various areas of substance use treatment and counseling. After a period of time of working in the field, and if the individual has completed an associate's degree, a bachelor's degree or higher in the mental health field, focused on addiction studies, mental health or social sciences, they can then apply to become a licensed alcohol and drug counselor. But again, you need to complete the CADC process first. I have lots of students who say, well, I want to get my bachelor's degree and then I want my LADC. You have to follow the steps for this particular license. You start at the CADC, you work under that for a while, and then you move towards the LADC. So you have a degree, you have some work experience, and then you need to pass a second national exam, also overseen by the IC and RC, and it's called the Advanced Alcohol and Drug Counselor Exam. You need to complete the application and pay the fee for the application as well as the fee for the licensing exam. And I have a link here to the board rules that explain this license. So our specific certificate at UMA, called the SART. The SART stands for Substance Abuse Rehabilitation Technician. It is an academic, it is an educational certificate that you can get at UMA. It includes 30 credit hours, 10 college classes, and it allows students to demonstrate that they have successfully completed the necessary coursework to sit for the Maine Certified Alcohol and Drug Counselor National Exam. Once a student successfully passes the exam and gets certified as a Maine CADC, mental health agencies are able to bill for your services. This professional credential is necessary if you want to be hired in an agency that offers substance use disorder treatment and working at that level, at that CADC level. So here are the 10 classes required for the SART certificate. Each of these classes is also 3 credits each for a total of 10 classes, 30 credits. The required classes include HUS 101, Introduction to Human Services, HUS 125, Introduction to Substance Use Disorder, HUS 212, Case Management, HUS 232, Crisis Intervention, HUS 233, Trauma Recognition and Intervention, HUS 305, Group Process, HUS 308, Assessment and Planning, HUS 326, Counseling for Substance Use Disorders, HUS 335, Substance Use Disorders, Counseling with Diverse Populations. And completing, and the 10th class in the series, this one you have a choice. We have 3 different classes that we offer for this 10th class. You can either take HUS 222, Psychosocial Rehabilitation, or HUS 332, Relational Systems that Support Substance Use Disorder, or the third option is HUS 342, Substance Use Disorders and Trauma. So once you complete these 10 classes, you become eligible to contact the registrar and request your SART certificate. So with the SART, again, it makes you eligible to apply for your CADC. If a student is in the bachelor's degree pathway, and are in the substance use, let's see, I think it's called the addiction counseling concentration. We only have concentrations at the bachelor's level. This doesn't apply to the associate's degree. You're in the bachelor's pathway and you have the addiction counseling concentration. This sets you up very nicely to pursue your CADC when you have completed your bachelor's degree. You would have a nice breadth of classes and knowledge to prepare you to sit and successfully pass the licensing exam. I do let students know, even though their MHRTC alone allows them to apply for their CADC license, there are very limited to no substance use classes in the MHRTC pathway. So while it allows you to apply for the license and sit for the exam, I want to be honest with students and say, I'm not convinced that you get the breadth of knowledge that you need to successfully pass the licensing exam with only the MHRTC courses. So just because you can do something doesn't mean you're appropriately prepared for what is required on the other side. Questions for me about the SART?
Oh, we have tons of questions.
Okay. All right.
So Muriel is asking, is this the same certification that UMA has for substance use, or is this something different? I think this is the same thing. Also, I have all of these classes transferred from EMCC. Would I still be able to get the SART certification?
So, all right, I hear 2 things. So this is our only undergraduate certificate in substance use treatment. So if she's saying, is this the certificate, then yes, I'm talking about it because it's our only one. So we have this certificate, or you can be in the addiction counseling concentration in the bachelor's pathway. As for the second question, an individual can only get the SART certificate if they took 50% of the classes at UMA. If you took 75% or more at a community college or somewhere else, you were not eligible for the certificate because your training wasn't from UMA.
Okay. Oh, and Muriel followed up with, she meant the same certification that EMCC has.
I can't speak to to what certification EMCC has. I can only state, so you could look at the classes that you took at EMCC and then go to the CADC licensing rules, and they list the classes that you could use towards the minimum 30 college credits. And I would expect that the EMCC classes are on that list, but you would be applying for your CADC based on the EMCC courses, because you would not be eligible for the UMA SART since you didn't take those classes with us.
And then Heidi was asking if she already has her CADC, does it make sense to get the SART certificate?
No.
Okay.
Now, if you're working towards a bachelor's degree, the bachelor's degree, especially if you're in the addiction counseling concentration, is going to open up more professional doors for you than the certificate. The certificate is created as an entry level for someone who, we have students in the certificate pathway who say the idea of getting a bachelor's degree when I'm only going to school part-time and I'm taking care of my kids and I'm working feels overwhelming. So I'm going to start with the SART certificate. And then I know I only have to take 10 classes in the next year before I can get a tangible credential that allows me to go and work in the field. And if I do good, and if I like staying in school, then I'm going to take my SART and I'm going to stay and get my associates. I'm going to take my SART. All of these classes actually would transfer seamlessly into the bachelor's pathway. So any student who starts with the SART can bring all 10 of these classes over into the bachelor's degree without losing any of the classes in the process.
And this might be a good time to mention, and thank you, John, for mentioning this, that the 30 credit certificates, so the SART and the MHRTC, these certificates are financial aid eligible. So even if you wanted to start out at these levels, you can incorporate those classes into, the associate's degree and then also the bachelor's degree.
Thanks for saying that, John. I didn't get into financial aid at all through this process. I tried to draw those lines, but a really good point. These are considered educational pathways and a credential that you graduate with. And we normally think of graduating when students finish an associate's or a bachelor's degree, but we have students graduating every semester, completing one of these certificates, and then they have a tangible credential. They can go into the field and work.
And I think that's all we have for now.
Okay. All good questions. All right, so this next one is the BHP, the behavioral health professional. And I know someone asked earlier about any connections between the BHP and the MHRTC, and there is no connections. And that's partly because they're created to work with really different populations. So the MHRTC created for adults with severe and persistent mental illness who live in the community. That's what the C stands for, community. And the MHRT1, adults with severe and persistent mental illness who live in residential facilities. So, but the BHP, what this slide is about, is the focus of the BHP is to work with children and families. So agencies and organizations who hire BHPs are looking for a really different training and background than what you would get within the MHRTC curriculum. So they often, BHPs often work in children's homes, their communities, and their schools. The certification is overseen by Woodford's. And the training is currently offered for free due to a state grant covering the training fee. And to take the training in the past cost between $200 and $250. And there's currently a state grant. So any individual interested in completing this training and having this credential can participate in the training right now for free. If a student at UMA would rather take the training through us, we actually offer a class that gives you the BHP professional certification at the end of the 15-week semester. It's called HUS 354 Behavioral Health Professional Certification. It is currently going to be offered again in the fall. I'm making the schedule now. So in the fall of 23, we're going to offer HUS 354 again. So if a student would rather take it as an academic course, have it be part of their curriculum and on their transcript, and still receive the state level BHP certification, you can do that by taking HUS 354. If any of you out there have your BHP certificate already, you can apply through Haley Brown to take that certificate, share it with Haley, and get credit for a three credit HUS course. You get credit for HUS 354. So if any of you already have your BHP certification, you can work with Haley, get that certificate to her, and you can request to have get those 3 credits because you already have that training and education.
I do want to clarify, because there are different levels of the BHP training, that has to be at least the one with 35 hours. It can't be like the first module or anything like that. It has to be the full certification. But I just put my email address in the chat if you have it. If you have the BHP certification, and I'd be happy to work with you to see if we can post credit.
Thanks for clarifying that. So yeah, and I agree with Haley that it's only if you have the full certification. So the training that Woodford's offers has multiple modules. So it's set up like an online course. You have multiple modules, but it also requires some in-person training time. And for some students, that may or may not work for them. So you have a couple of different options. So again, this is a very specific type of role and jobs, working with children and families in the community, in their homes, and in their schools. You have to be comfortable in those settings and understanding that you would be working usually with a team. You would have someone in a more clinical role outlining a plan of care. And then you would be working with the child one-on-one to implement that plan of care. And it's usually focused on learning issues and behavioral issues that the child might be struggling with. Any other questions about BHP?
I don't see any at the moment.
Okay. All right, so there's a couple other additional requirements for individuals who want to work as a BHP. You need child and adult CPR first aid certification, and you have to complete a OSHA bloodborne pathogen training. All right, so now we're going to just talk quickly about our associate's degree pathway. So an associate's degree in mental health and human services, you need to complete 61 credits, and that is a mix of general education courses and human services courses. It allows a student to apply to become an MHRTC, a CADC, or applying for jobs that require minimum education of an associate's degree. Students in our bachelor's degree program can request their associate's degree along the way once they have completed the associate's degree requirements. And I have a lot of students in our program who are not necessarily aware of that. So if you are somewhere over 61 credits and want to look and see how many of the associate's degree classes you have already completed and which ones you should prioritize next, if you want to earn your associate's degree along the way, please feel free to contact myself, Haley, Katie, or your one of our other professional advisors, such as John McLaughlin, or any of our other faculty advisors. And we can help walk you through how close you are to being eligible for that credential. And you don't have to change your status of being a bachelor's degree student to pursue this option. All right, any questions for me about associate's degree?
Not necessarily about the associate's degree, but Sandy was asking about the fact that she had taken the bloodborne pathogen test through Maine General. Would that count? I'm assuming for the BHP.
She would have to, if she's pursuing the BHP, it would, the note I had said it had to be within the last 12 months, but it would have to be within the last 12 months after you completed the BHP training and you're applying for the full certification. I expect it's probably a bundle deal that you would need to have all of those completed within a certain period of time.
So and she had followed up with, do you just take the CPR and first aid anywhere and then just show the certificate? So kind of like the bundle deal.
Yeah, and any of those questions, she should direct those to Woodford's, since they're the ones who oversee giving out the BHP certifications. All right, so I'm going to move on to our bachelor's degree. Bachelor's degree in mental health and human services, completion of 121 credits. And this is also a mix of general education courses and human services courses. It allows a student to apply to become an MHRTC, a CADC, a licensed social worker conditional, and that acronym is LSX, or jobs requiring minimum education of a bachelor's degree. We're going to look at the LSX next. So the UMA, Bachelor's of Mental Health and Human Services, allows a student to apply to become a licensed social worker. The full license is called an LSW at the bachelor's level. Students need to apply after graduation to become a conditionally licensed social worker, LSX. An LSX needs to work under a fully licensed social worker for 2 years during their conditionally licensed period. After the 2-year supervisory period, they can sit for the national LSW exam. Once the exam is passed, they can then become a fully licensed social worker in Maine. Maine allows individuals with a few specific bachelor's degrees to follow this pathway. Other states do not. I was working with a graduate from our program who lives in another state, and she and I researched her state's licensing criteria, and they do not allow anyone without a bachelor's degree in social work to apply for the licensed social worker license. Maine has different criteria and has allows our bachelor's degree is one of the accepted degrees for this conditional pathway. So I want to clarify, you are not graduating from UMA with a bachelor's in social work. You are graduating from UMA with a bachelor's of mental health and human services. Our program is accredited nationally in regards to human services education. But because there is enough human services focus, you are eligible to pursue this license after graduation. You cannot apply before graduation. You cannot start your supervisory 2-year period until after you receive, until after you apply for the license. I've had students ask me before, well, can I, if I need continuing education for my license, can I front load it while I'm a student? No. Your license, once your license is in your hands, then the clock starts. It starts for the 2-year supervisory period and your time to prepare to take the national exam.
Rochelle had a question about whether or not you have to take a state exam if you move to another state after you get your LSW.
It's called reciprocity between states. So for example, if you get your LSW in Maine and then you want to apply and you want to move to South Carolina, and South Carolina only allows LSWs who have a bachelor's degree in social work, you would have to apply to their board of social work, and then that board decides, and they may or may not accept your license from Maine because you do not have the educational criteria that they require within their state. So this is where I continue to encourage any student who wants to live in a different state to work and practice, to research the licensing expectations for that state. Every state is different, and every state has different levels of reciprocity. Some states are like, great, you have a license somewhere else and it's a super easy process. And then other states, it can take months and months providing details and paperwork to try to convince that state that the license you have from Maine is equivalent to theirs.
That's all we have for now.
Okay. So for the LSX, what can you do with it? So some agencies like the Department of Health and Human Services, DHHS, require their caseworkers, such as child protective workers, foster care workers, adoption workers, to be fully licensed social workers, or a licensed social worker conditional for billing purposes. And that also helps to have the organization have a certain level of expected training and oversight for the work that they're doing. So each of these licensing levels requires that the individual have completed a bachelor's degree in either social work or another social science field, such as mental health and human services, sociology, or psychology. So to pursue this license, you would have your transcript from your bachelor's degree in a field related but not specifically social work, such as our mental health and human services degree. You would need to provide a signed agreement that a licensed social work professional will provide you with regular supervision. And regular supervision means that you're meeting with that person pretty much weekly for 2 years, because they're overseeing your work to make sure that you are working within social work's ethical boundaries and that you are developing your skills during that conditionally licensed period. They need some sort of proof that you have a job in the field, and you need to complete the application and pay the fee. It is overseen by the Social Work Licensing Board, and so that's what this link is here, is to their page. So once you've completed your 2-year supervisory period, you're still going to display that you have a completed bachelor's degree in your related field, and that you have been working for 2 years under a licensed supervisor. That supervisor needs to fill out a form attesting to the fact that they provided you with supervision, documenting the amount of hours that you worked in that 2-year period, documenting the amount of supervision that they provided. If you change jobs within that time period and end up with 2 different supervisors, you need to provide documentation from both supervisors to cover that time frame. If you are only working part-time during that minimum 2-year period, you can stretch it out to 3 or 4 years, but there is a certain amount of time where they want you to complete this training and supervision and move on to the next level of licensure. So once you've completed your supervisory time, you're then going to take and hopefully pass the national exam for the LSW level. You're going to submit 3 levels of recommendation, and you're going to pay the required state of Maine licensing application fee and exam fee. And as I look at this information, I actually think the social work licensing has removed the requirement for the 3 letters of recommendation, but I'll have to check that and make sure. Over the last couple of years, they've made a few modifications to the process, trying to have it be not quite so onerous. Questions for me about the LSX and the LSW?
Give folks a couple seconds to type. Well, it doesn't look like anybody has questions right now.
Okay. All right. So the next thing I want to say is that our mental health and human services program is not a clinical program. The bachelor's degree in mental health and human services does not prepare students to become licensed therapists or counselors. You cannot work in an independent capacity in the mental health field. You cannot work as a school counselor or social worker with this degree. So I'm sort of referring to a social worker in a school. Most schools require someone to be a master's prepared individual. You can work towards more independent licensure as a substance use counselor. Once you get your CADC and some years of experience, you can progress to your LADC license, which does allow you some independence in the field of substance use counseling. But I just want to make sure that students, when they graduate from our program, know that we're not you're not eligible for a clinical license after completing the bachelor's degree. If your goal is to become a clinical professional, then you need to apply to graduate school and earn a master's degree. You will do when a graduate school program, a master's degree program, will have you do a deep dive, taking courses in your specialty area to develop expertise in that area. An undergraduate curriculum, you are taking classes at the 100, 200, 300, and 400 level. And those represent your freshman, sophomore, junior, and senior years. So your senior year in the program, you're taking 300 and 400 level classes. Once you graduate with your bachelor's degree, if you go on to graduate school, then you're taking 500 and 600 level courses focused on the topic or the specialty area that you're learning about. And the coursework also reflects that next layer of intensity. So some of the graduate school pathways that we see students take when they graduate with their bachelor's degree and they do want to do clinical work is we have students who apply to get a master's in social work. And those programs generally are 2 years full-time to earn your MSW, Master of Social Work. And that allows the graduate to become a licensed master's level social worker or a licensed clinical social worker. We have other students who pursue becoming, getting their master's in counseling, and there are a wide variety of different specialties in this: mental health counseling, rehabilitation, school counseling, marriage and family therapy, couples counseling, and more. And generally that is also 2 years full-time to complete. And these allow graduates to become a licensed clinical professional counselor. And while I say these programs are 2 years full-time, we have lots of students who pursue completing these programs in what are called hybrid models, where you could take up to 3 years to complete this on a more part-time basis. Some other clinical pathways include PhDs, and I know students at UMA, when I talk about PhD pathways, I might get big eyes, but I want students to know these are some of the other pathways to doing this work at lots of different levels. All right, so I've talked a little bit about the clinical levels here, but I think we're good there. And with that, I am open to additional questions.
Go ahead and drop your questions in the chat and I will ask them of Wendy. My name is Katie. I'll be emceeing this portion of our evening. So yeah, just drop those questions in the chat, fire away, and we'll keep going with whatever information people.
I know I got a lot of good questions as we went through, so there may or may not be them, but are there other things in this session, we didn't talk about field placements or any of that. That's going to be part of what we're talking about in the second session that we're offering.
I'll ask one real quick, just because I know I've got some students who asked this question of me, Wendy. If they are leaving a correctional facility, are there any degrees that we just talked about or certifications that we talked about tonight that they are not eligible for?
So I want to be clear that any degree or educational certificate from UMA, a student, no matter their location or history, would be eligible to receive that educational credential. The question becomes, can that individual use the educational credential to pursue a state level license or certificate? And those decisions are made on a case-by-case basis. The information that we have from licensing boards is that they do conduct background checks. They are looking at an individual's prior history and making decisions case by case based on that. There also is a recognition across the state of Maine that we have a need for more trained mental health professionals. We want to have a focus on rehabilitation, and we're hearing a lot more flexibility with allowing individuals who do have some issues in their prior history to be able to enter the field. But I would never tell any student that it's a guarantee, because that would not be honest and truthful. And I want to just be, upfront and say, will there be a background check? Yes. Will you potentially be asked questions about what happened? Yes. And then from there, it is up to each of the licensing boards to make a decision based on the information they have in front of them about you.
Fantastic. The next question we have in the chat is, what would be the best track if I want to go into policy?
Okay, so if you want to go into policy work, which on the social work side, they sort of call macro social work, where your goal is not to work one-on-one with individuals, but in fact to work on the broader policy side. At UMA, I would recommend going into the generalist, the bachelor's degree pathway with the generalist track. And then that allows you to pick and choose the human services electives that you want that are going to be most closely focused on what you're interested in. And then from there, if you have interest in graduate school, you could pursue a master's degree in social work focused on that macro policy side. We also have students who have gone to pursue master's degrees in public policy, where that's what you focus on. Your bachelor's degree gives you this general foundation, and then you would dive into that policy side at that other level.
And UMA does have a public administration program as well. So if you wanted to, focus on mental health and human services and supplement with a couple public administration courses, you can. So just be aware that that exists. All right, next up, we have a phenomenal question. I am just wondering if you are going for your bachelor's in a different field like nursing or psychiatric nursing, if you could get licensed in any of the things that you mentioned in this presentation.
All right, so if you're going into nursing or psychiatric nursing, you're going to become licensed as a nurse, and your licensing would be overseen by the nursing board of Maine, and that's where you would receive your license. The pieces I talked about today are very course specific. So the chance that a nursing student would have completed all 10 of the MHRTC courses would be, you know, a low chance of that. Same with the SART. And the social work licensure for the conditionally licensed social worker, nursing is not one of the degrees under that criteria. We do have a, I'm trying to remember, and I see Dr. Lane is on this call too, is the inpatient psychiatric services. Kim, is that a minor? I don't have many students in that pathway, so I'm trying to picture it.
I just asked her to unmute.
There, okay. It is not a minor, and it was just designed for folks for Riverview at the time.
Okay. All right.
But
So
with
it
a
is-
nursing degree, you wouldn't need this if you became a psychiatric nurse or became certified to do mental health nursing. It kind of is in the line of the MERT-C.
But the nursing license would be the credential that you would be pursuing.
Yeah, it would.
That's what would allow you to do the work for a medical or mental health organization.
Right, I think what the student was trying to potentially get at is, would it also be helpful to have an additional one of these licenses in addition to nursing? Would that make them better prepared or more competitive for a job potentially by having some additional training? And if it doesn't, are there maybe a couple classes that would be a good idea if getting the license makes less sense, knowing that they'll be licensed as a nurse?
And I'm always really thoughtful about how many classes is realistic, and that once you start having a student, such as a student in a nursing pathway, say, well, if you took an additional 10 classes, well, full-time, that's a whole other year. And that to get what's considered an entry level certification, that doesn't necessarily financially or time-wise make sense to me. So I wouldn't generally recommend that to somebody. Instead, I would say, you know, if you have some room for electives or your general education courses that you can pick, you know, your general electives, then feel free to look through what we offer on our mental health and human services side, especially if you're interested in psychiatric nursing. We have a lot of great options there, as well as our substance use treatment courses, because I would expect that you are going to encounter individuals who are struggling with both mental health issues and substance use disorders.
Fantastic. All right, does anybody else have any questions they want to drop in the chat? All right, if there are no other questions, Wendy, do you want to talk about the follow-up session to this in case there are people who are interested in attending the second session, but maybe haven't registered yet and are on the call already?
So I don't have the information in front of me. Do either you, Katie, or Haley have it in front of you? I want to make sure I have the date and time correct.
Yeah, it's going to be February 16th from 6 to 7:30 p.m. And it's going to be focused on finding field placement and or what the job market looks like when you graduate from the Mental Health and Human Services program at UMA. And I believe we will be comparing opportunities by certificate, associates, and bachelor's degrees, the range of positions that are available, and the types of pay that are corresponding, as well as the top employers in the state of Maine for this specific field.
And Dr. Kim Lane will be in charge of that session along with John McLaughlin and myself. I will also be talking about credit for prior learning because we have a lot of students who have worked in the mental health field for a number of years. And as with the BHP certification and getting credit for that course, there's a whole portfolio process that I'll cover in this session where you may be able to earn some credits.
So I will, I'm just going to do another quick screen share to finish us off. There we go. Bigger. So this is our contact information. So if you have any questions for Katie, here's her email and phone number. For Haley, here's her email and phone number, or for myself. Whoops. Where'd it go? There we go. So, so there's that contact information. And as I am the academic coordinator of the Mental Health and Human Services program, so even if I am not your faculty advisor, I let any student in the program know if you have questions about the program, about what you can do with your degree, about what you should take next, feel free to reach out to me and reach out to me or one of these other individuals here or our professional advisor, John McLaughlin, and we are here ready and happy to help you. We want you to be able to picture what your future is while you're here at UMA and to help set you up for success as you prepare for your next educational and professional steps. So let us know how we can help you, and we are glad to do it. And I want to say thank you, everybody, for joining us today. It was great to see such a large turnout. Certainly when I'm in my slides, I can't see all of the squares here. So great to see so many people here interested in working in our field. We have a shortage of individuals in the mental health field and really want to welcome all of you to find your niche in the field, to think about what consumer population you might want to work with, and let us know, and we'll do our best to help set you up to get there.